Action. Hi Jojo, I'm Allie. I'm going to be your student PTA today. Can I just verify your last name and your date of birth?
Yeah, it is 3/24/1987. My name is Joanna Fuller. You can call me Jojo.
Awesome. Fantastic. Okay, so what I'm seeing in your plan of care today is that your PT wants to go through some positional training. So we're having a little bit of issues with the breathing, we're having a little bit of issues with getting that mucus out. So what this is going to help with is we're going to decrease the mucus, we're going to increase your oxygen consumption, and we're going to decrease your respiratory rate, which means you just don't have to work as hard to breathe, okay? So it's going to be a lot better. First and foremost though, there are some contraindications that we need to be aware of. Do you have any kind of fractures, rib fractures? Are your ribs bruised? Okay, good. Do you have osteoporosis at all?
No.
Okay. This would also be in your chart, but I just want to make sure from you. Sometimes, you know, we don't get everything in the chart, so I just want to make sure from you as well, okay? Do you have any kind of circulatory issues? Any kind of blood clotting issues, blood thinning issues? Okay, good. GERD, do you have GERD? Nausea? Great. And have you recently eaten?
No.
Okay, great. Just because when you recently eat and I'm banging on you, sometimes other things can come up than mucus, so we need to be aware of that. Awesome. So what I want to do first and foremost is I want to auscultate. I want to, what that means is I'm just going to listen to your lungs. So when I'm listening to your lungs, I want to listen to each segment. When I go through the segments, I'm going to kind of go through it with you just so you know what I'm doing, okay? But when I listen to each of the segments, I want to see if I'm hearing any kind of abnormal sounds. When I am, that's what we're going to percuss, and that's what we're going to shake and vibrate, okay? And we're going to get you into a position that's great for that segment.
Okay.
And this positional draining just gets those segments into the bronchial tubes where they're vertical, and the mucus can come right on out, okay?
Okay.
Are you understanding what we're going to do today?
Yes.
Perfect. So another thing, is it okay if we remove your shirt? Great, and then I may ask you to move your breast tissue for me, just so that I can auscultate a little bit easier, okay?
Okay.
Awesome. So that's what we're gonna do. So, first, can you just remove your shirt for me?
96 to 100.
That makes you like my layers.
You're fine.
Okay.
Great. Okay. So first and foremost, I'm just gonna listen to your trachea.
Yeah,
Okay,
oh.
and it's gonna just tell me how your bronchioles are working.
This girl.
So what I'm doing is I'm finding the sternal notch,
wanted to say
and then I'm just
facetious
listening
for
to
a
the
second.
trachea. Sorry, my hands are
No,
full.
I was trying to remember what the word was.
No, you're right on the decision.
Okay, there we go. Okay. So
Great, I'm also assessing your respiratory rate right now, which is really good. So far you're normal, you're within normal
Okay.
ranges, which is 12 to 20
he's got
breaths
fast,
per minute, so that's
shallow
great.
rhythm.
So from the trachea, I'm gonna go down and I'm gonna find your sternal angle. When I find that sternal angle, what I'm looking for is I'm looking for the second rib. So when I find that sternal angle, which is right here, I'm gonna go over, there's a second rib there. And I want to listen
Have you ever seen Tom Brady?
right there.
It's pretty slow. So Brady.
Great, and this is the anterior segment, the upper lobe.
All right, so I'm going to be taking
This is your right
measurements.
upper lobe.
So the first measurement is the
Great, and
sternal
then just
angle.
come over to the other
Second
side.
measurement is going to be around his xiphoid process, and then the third is going to be between
And this is the
his
anterior segment of the left
focus
upper
and
lobe.
his xiphoid process. So I still have permission to take these measurements. Is that okay with you?
Good. From the second rib, what you do is you come down from the second rib and you count down to the fourth rib. So here's the fourth rib. I'm gonna listen to the left side first.
And that's
So-
like in line with the second rib.
So on here it says to make sure that you use proper body mechanics.
Good.
Oh,
This is the linear
that I do?
segment. And it's in the left
You
upper
want them
lobe.
sitting up.
That'd be the best way to create
So I'm gonna have you
Good.
sit up straight.
Now I'm just gonna come right on over to the other side. Good. This is the medial segment of the right middle lobe. So far I'm not hearing any abnormalities, so that's good. Good. From the fourth rib, what we want to do is we want to go down to the sixth rib. Sometimes I have to readjust.
What
Two,
we're gonna do
3, 4, 5, and 6. So I'm going to ask you to just push up your breast tissue for me. Thank you. Good. This is the anterior segment of the right lower lobe. Sorry, it took me a minute to hear it. I'm gonna just, right there. Good, this is the anteromedial segment of the left lower lobe. Good, and we're gonna say that I hear some crackling in there. Okay, so now what I want you to do is I want you to turn over for me.